Level 1, the medical student. You arrive on your first ER rotation with a white coat that has never been washed and a stethoscope you practiced on your roommate. You stand near the wall and try not to be in the way. The attending doesn't know your name. The nurses don't care about your name. You are furniture in scrubs, occasionally directed to a different corner. The department moves at a speed nobody warned you about. A man codes in Bay 3. A child screams 2 doors down. A woman with chest pain sits in a hallway chair because there are no beds left. You watch the resident work through all of it with a calm that looks almost inhuman, and you understand for the first time that this is a skill no lecture hall will teach you. A nurse asks you to hold pressure on a wound while she gets supplies. 14 minutes. A homeless man. Gauze soaked through. You don't move. When she comes back, she says, "Good job." It is the first useful thing anyone has said to you. You go home and cry in the shower and come back the next morning. Level 2, the intern. You have a license now. That is the terrifying part. A license and a pager and a patient list, and the steady conviction that at any moment someone will understand you have no idea what you are doing. The fear is not irrational. You are learning by making decisions about actual human beings who did not know they were consenting to your education. A woman presents with abdominal pain. The chart is thick with prior visits. The nurse gives you a look when you walk in. You examine her. You order imaging. The CT shows nothing. You give her something for the pain because she is in pain. You don't know if you are right. You will never know. You miss a potassium level in month 4. An elderly man. You discharge him. 4 hours later, he arrives by ambulance in cardiac arrhythmia. He survives. The attending explains what you missed without cruelty, just precision. You carry that case for years, longer than the patient carries it. You stop sleeping deeply, not dramatically, not in any way anyone notices. You just stop landing all the way down. You float near the surface, half listening, for something to go wrong. Level 3, the resident. Your hands have learned things your brain hasn't articulated yet. You suture without thinking about suturing. You intubate with a focus that closes everything else out. Your pattern recognition is assembling itself from thousands of patients into something that works like instinct but cost more. The ER shows you its social architecture. Which nurses trust, which doctors, which attendings cut corners on paperwork, and which cut corners on care, which patients have been quietly labeled difficult and processed with minimum engagement. Frequent flyers. People who arrive every few weeks with the same underlying problem. Mental illness, chronic pain, no housing, no support, no solution medicine can provide. You watch how the senior residents handle them. Fast. Not unkind, exactly, just absent. You begin building your own version of that absence. Not a decision. A formation. The way callus forms over repeated pressure. One devastating outcome. One night spread too thin across too many critical patients. One family in the corridor blaming you for a death that nothing could have stopped. The distance is not cruelty. You tell yourself that. You are not wrong, but something is leaving you and you don't stop to name it. Level 4, the attending. You are done training. The residents present to you. The nurses come to you with questions that used to belong to someone else. The buck stops here, which means when something goes wrong, it does not travel further. It ends with you. The department runs on a logic that has nothing to do with medicine. Throughput, door-to-doctor time, length of stay averages, patient satisfaction scores submitted by people who may have just received the worst news of their lives. Administration sends quarterly summaries. Your waiting room rated 2.7 out of 5. You read this at 3 in the morning between a 22-year-old overdose and a 70-year-old stroke, and you do not reply to the email. You keep a list in your head you never wrote down. Not mistakes, mostly. Just outcomes. The young man who died despite everything done correctly. The family who blamed you for something that had been terminal for years before they arrived. Nobody talks about the list. Everyone carries one. Level 5. The veteran. 10 years in. Your clinical judgment carries the weight of 1,000 decisions behind it. You can assess a patient from the doorway, sick or not sick. The instinct has saved lives. You know it has. You have also become calibrated in ways that trouble you at the edges of quiet moments. Time per patient, calibrated. Delivery of terrible news, calibrated. You have wondered whether you have lost warmth in the process of not losing your mind. You have not answered that honestly. 50% of emergency physicians report burnout. The number is in every journal you no longer have time to read. You know 3 colleagues who left medicine in the past 2 years. 1 opened a restaurant. 1 teaches. 1 you don't ask about anymore. You tell yourself you are in the other 50%. Some days you believe it. A pharmaceutical representative visits with lunch and data on a new analgesic. The data is clean. The food is fine. You eat the lunch. You tell yourself a sandwich cannot influence your clinical decisions. Everyone tells themselves that. The studies say otherwise. Level 6, the trauma lead. You are the one they call when it is very bad. Multi-vehicle accident. Gunshot to the chest. Industrial injury with no clean answers. You stand at the center of controlled chaos and you direct it. People move because you speak. The room reorganizes around your judgment. It is, in some stripped-down way, the reason you came to medicine. The clarity of it. The absence of ambiguity when the situation is bad enough. But you go home afterward. That is the part no one films. You sit in your car in the driveway for 7 minutes before going inside. You have done this for years. Your family has stopped commenting on it. You don't examine it too closely. The 7 minutes are doing work you can't name, and you have learned not to interfere. Level 7. The department chief. The previous chief left for urgent care. Everyone in the department understands what that transition means for a person. You accept the position because the clinical work no longer asks you questions you haven't already answered, and you need new problems. The new problems are meetings, budget reviews, compliance cycles, quality improvement documentation. You sit at a table with administrators who have never worked a night shift and you translate between 2 languages that do not map onto each other cleanly. Medicine speaks in individual human beings. Administration speaks in aggregated data points. You have become fluent in both and trusted by neither. You sign a policy reducing resident contact time with patients before escalation to attending. Throughput improves by 11%. You also understand, without discussing it, that you have just trained the next generation to move faster than medicine sometimes requires. You move to the next agenda item. A resident comes to your office. She is struggling, not with the clinical work. She is excellent at the clinical work. She asks how you manage what this job does to a person over time. You give her the standard language: sleep hygiene, exercise, peer support resources. She nods. She thanks you. She leaves. You sit in the office after she goes. You cannot remember the last time you answered that question honestly. The honest answer is that you manage by rooting around the parts of yourself that would slow you down if you let them speak. You have become very precise at the rooting. The department runs well. The metrics are good. You do not look too closely at the cost. Somewhere in a lecture hall, a first-year student is watching a documentary about emergency medicine. She is taking notes about the pace and the privilege of being present on the worst days of people's lives. She is not thinking yet about the list she will carry. She is not thinking about the distance, or the 7 minutes in the driveway, or the particular quality of decisions made at 4 in the morning that do not fully leave you. She is thinking about saving lives. She will save lives. The doors open. Someone is coming in. The cycle continues.